Hello guys, my name is Oluwole Simeon aka Olusim. Welcome to You and Your Health. And on this episode, I'll be talking about different types of hypertension. Different types of hypertension. Now, knowing the type of hypertension that you have is very, very crucial in determining the kind of treatment and management strategies you are going to deploy. And not knowing the type of hypertension is the reason why some hypertension remains irreversible. I want you to follow me on this episode and stay connected. So, high blood pressure or hypertension has been classified to different types based on causes and characteristics. Now, these are the main types of high blood pressure or hypertension that we have. Number one, primary hypertension. Primary hypertension. This is also known as essential hypertension. Now, it has no identifiable cause. Primary hypertension has no identifiable cause and it develops gradually over years. And this has been linked to genetics, poor diet, lack of exercise, and old age. Okay, number two is what we call secondary hypertension. Secondary hypertension occurs as a result of underlying health conditions such as kidney problem, hormonal imbalance, certain medication, and sleep apnea. And it often appears suddenly and could be more severe than primary or essential hypertension. Number three is what we call isolated systolic hypertension. Isolated systolic hypertension. Now, this is often common in older adults. It's common in older adults, and it occurs when the systolic blood pressure, that's the top number. Now, when you are measuring your blood pressure, you discover that there are two numbers, the one at the top and the one below. The one at the top is the systolic blood pressure, while the one below is the diastolic blood pressure. Now, when the systolic blood pressure is higher or elevated than normal, but the diastolic remain normal, this is what they call isolated systolic blood pressure. It is often the causes of heart attack, heart problem, strokes, and the likes. So number four. Alright, so number four, resistant hypertension. Resistant hypertension. Now, this occurs when your blood pressure remains constantly high, despite even taking different kinds of medication, at least 3 different kinds of medication, including diuretics. So your blood pressure still remains very, very high. Now, this may require some different kind of treatment approach and certain lifestyle adjustments. You can see this different kind of hypertension. Now, we are going to continue on the other type of hypertension after this short break. Stay connected. So, number 5, malignant hypertension. Malignant hypertension. Now, this is a medical emergency because in this situation, the blood pressure rises rapidly and very, very high. It's on a very high rate and it rises rapidly, and this will result into organ damage. And most of the time, this malignant blood pressure often presents with symptoms like a severe headache, chest pain, and blood vision, and that's malignant hypertension. Alright, so number 6, we have white coat hypertension. White coat hypertension. Now, this kind of hypertension occurs when your blood pressure rises when you are in a clinical setting and becomes normal when you are outside a clinical setting. What do I mean by clinical setting? It means when you are visiting an hospital or a doctor, your blood pressure becomes to rise. They begin to rise, and when you are done outside that clinical setting, your blood pressure becomes normal. And it is as a result of anxiety or being nervous when you are visiting the hospital. And see, this kind of hypertension if not treated on time, could actually pose a risk of developing sustained hypertension. And so the last but not the least, number 7 is what we call, person number 7, we have what we call masked hypertension. Masked hypertension. This is actually the opposite of white coat hypertension. It means that this kind of hypertension, in a clinical setting, the blood pressure remains normal, while outside the clinical setting, the blood pressure is elevated. Now, this kind of hypertension often goes unnoticed, except it is being measured accurately at home. So these are the different types of hypertension that we have. And you see, understanding the kind of hypertension that you have is very, very essential and crucial to the type of treatment and management strategies that you are going to use. By the grace of God, coming next week, I'm going to be exposing us to an holistic approach to reversing hypertension. No matter the kind of hypertension you may be having presently, this holistic approach will definitely reverse this kind of hypertension. So I want you to stay connected to this channel, like, subscribe, and share with your friends. Thank you very much. I remain Olusin. See you next week. God bless you.